Hi, hello guys, welcome to Renis Nursing Academy, Nagarkoil. Hope you all are doing good, staying safe. Before going to the topic, don't forget to subscribe our YouTube channel Renis Nursing Academy and also click the bell icon so that you can get your notifications. Yes, I'm welcoming you all for a series 1, that is electrolytes, as I told you in my previous video. Yes, we're gonna see about the first electrolyte, that is one of an important electrolyte called sodium. Hope you all have some little idea about this particular electrolyte sodium. Let me give you another more information regarding this sodium first. The first important thing is this is considered to be one of the most important electrolytes among all the electrolytes. You already know about the compartment, that is extracellular fluid compartment and intracellular fluid compartment. Among that both, this sodium will be coming under ECF, that is extracellular fluid compartment. The first main thing about this particular sodium is this helps to regulate the amount of water that will be in and out of your cells. So the sodium was more close towards your cells. So it mainly help in regulating the fluid volume or the amount of water in your body. Then the second main thing is about the relationship between the sodium and the muscle. The sodium allows the muscle to fire and the brain to work. So it mainly work in the contraction and relaxation of the muscles in your body. Then the next thing is about, as it considered to be osmotically active cation, it helps in regulation of membrane potential of the cells. As I told you already, it was so close towards the cells. So it is again the same thing is coming. It mainly helps in regulating the potentiality of the cells. Now let me tell you what will happen if there is increased amount of sodium in your body. If it is decreased amount of sodium in your body, what will happen? So today we gonna see about the decreased amount of sodium in your body, that is called as hyponatremia. Here we go. First let me tell you what is the normal sodium value in your body. The normal sodium value is 135 to 145 milliequivalent per liter. So as we gonna see about the particular topic hyponatremia, that is less amount of sodium in your body, you already know it will be less amount of sodium, that is less than 135 milliequivalent per liter in your body is considered to be hyponatremia. Now let me tell you the causes. What are the causes that will responsible for developing hyponatremia? It is categorized into 3 things. One is increased sodium excretion, and the second one is inadequate sodium intake, and the third important thing is dilution of serum sodium in the body. Let me clear you one by one. First one, increased sodium excretion. For this, there are so many reasons under that. Let me tell you one by one. The first main thing is about diaphoresis. You already know what is diaphoresis, that is excessive sweating. Then the main second thing is about diuretics. The diuretics may be loop diuretics, or it may be thiazide diuretics, or it may be anything. Then the next one is about vomiting. You already know during the time of vomiting and also in diarrhea, you might have lost your electrolytes. So yes, here also the main electrolyte sodium we are losing in our body in case of vomiting as well as diarrhea. Then the second important thing I told you, that is due to inadequate sodium intake. So here the first thing is about nil per oral, that is NPO. Example, before your any kind of surgery, when you are posted for any laparotomy or any kind of surgeries, we will be based on NPO. So that time we can develop the problem called, or the electrolyte imbalance called hyponatremia. And the second important thing is already know about low sodium intake in your diet. So when you are taking less amount of sodium in your regular dietary practice, there is high chances you can go for a phase called hyponatremia. Then the next third thing is about dilution of serum sodium. So let me tell you some of the causes that can cause dilution of serum sodium in your body. Under that, first one is about excessive ingestion of hypotonic fluids. So I can give you an example of hypotonic fluids like half NS, that is 0.45 NS. So when you are giving that type of fluids to your patient, there is so many reasons they can end up with hyponatremia due to dilution of the serum sodium in their body. Then the next thing is about freshwater drowning. Yes, in case of drowning occurs in water pools or in rivers or anywhere, there will be direct ingestion of water by the particular victim. That will end up with hyponatremia in the body. Then the next thing is about SIADH, that is syndrome of inappropriate antidiuretic hormone. This particular thing can end up with water intoxication, that is hyponatremia can occur. Then the last one is about congestive heart failure. So these are all the reasons that can develop dilution of serum sodium in your body. So these considered to be the general causes of hyponatremia. And the next thing is about the symptoms. Let me tell you by system wise. Let me start from central nervous system because confusion is the most priority symptom in case of hyponatremia. So in central nervous system, symptoms like confusion, drowsiness, the patient can develop seizure and the patient can end up with coma. Then the next system is about central venous system. Here the patient can develop hypotension, rapid pulse rates and bounding pulse. Next one is musculoskeletal system. Here the patient can develop skeletal muscle weakness. This considered to be another important symptom in case of hyponatremia, and also there will be severe depletion in deep tendon reflexes in your body. The next is about gastrointestinal system. There you can see nausea, cramping and hyperactive bowel sounds. Then in renal, increased output so that the patient will automatically go for the phase called dehydration. So here you can see dry mucous membrane and also dry skin for the patient due to dehydration. You might have already know about all the dehydration symptoms. So all symptoms you can see for the patient with hyponatremia. So let me tell you about the investigation. It's very simple. You can directly take serum sample of the patient and you can confirm the patient with hyponatremia. And another important thing is about urine sample. You already know about the specific gravity. So here in hyponatremia, the specific gravity seems to be low. So low specific gravity you can find out for the patient with hyponatremia. Now let me start with the treatment. In the treatment, the first priority thing is all about the assessment. You already know for all the patient, when you are planning a nursing process also, you will keep the assessment first. So here also the same. You can go for assessment. You can monitor all the symptoms as I have mentioned you previously. The management is depending upon the problem. Let me tell you one by one. So if it is due to decreased fluid volume or if it is due to fluid volume deficit, you can directly go for the administration of IV fluid. Then the next thing is, if it is happening due to the problem of fluid volume excess, you can go for diuretics, especially you can choose osmotic diuretics, that is mannitol. In this particular mannitol administration, let me remind you one thing, always go for slow administration of mannitol or else the patient can develop cerebral edema. Another most important nursing intervention regarding this mannitol administration is check the urine output for every hour because mannitol can increase the urine output, that is it will be like 250 to 300 ml per hour. So always check the urine output during the time of osmotic diuretics, that is during the time of mannitol. Then the next important treatment what you can give for problem with SIADH, that I already told you, syndrome of inappropriate antidiuretic hormone. You can administer antagonist of antidiuretic hormone, that is example tolvaptan or conivaptan. These are all the medications you can give as an antagonist for SIADH. Next thing is about encourage the patient to take more sodium intake. The examples I can give you, that is bacon, that is nothing but salted pork. So you can tell your patient to take bacon, milk, butter, soy sauce. So soy sauce they can give in another words like soy milk, soya beans, everything is same. Then canned food, cheese, meat, table salt and processed food. So these are all the contents that generally content of having more sodium. So you can tell your patient to go for this particular dietary things. Then the next thing is about lithium management. Why I am telling about this lithium management in hyponatremia means you already know who will take lithium. So lithium is a mood stabilizer which has been taken by the patients with mania. So during the time of lithium management, you have to tell your patient to check the sodium levels because if the hyponatremia occurs, there is high chances there will be decreased excretion of lithium from your body that will end up with lithium toxicity for your patient. So don't forget to tell your patient to check the serum sodium level during the time of lithium administration. So these are all the common management things that will come under hyponatremia. Hope this content is useful for you all. And the upcoming video is about hyponatremia. Stay tuned tuned for our next topic, hypernatremia. Thank you so much. Stay safe.